Why is unity in the pro-life movement essential, especially today?
Mm, what a great question, Lisa. So, what is needed for these women is comprehensive care. So, we often say at Her Plan that we want to help them both and we want to collaborate for comprehensive care. And so, the woman needs more than one care provider, right? She might need her good pro life doctor, but she might also need that lawyer, that special needs support group, that NICU support group, that drug rehab. She might need multiple providers. So, if providers aren't working together, if we're not unified, if we're not having a comprehensive approach to defining the pro life safety net, then that means women are going to suffer and their needs aren't going to be met. So, if we keep that focus on moms and babies and women and families, it necessitates us knowing about each other, working together for a life affirming culture that does not support or refer for abortion, but provides the positive alternatives of true care.
If you had to say what you want your legacy to be, Chaney, and Her Plan, but maybe let's just speak you personally. Like, what do you want your legacy piece to be in this conversation of pro-life healthcare?
Mm. Well, I think it's right along with what you teach at Guiding Star, which is that pregnancy is natural and beautiful, and the pregnancy is not the crisis. At Her Plan, we help people realize it's not a crisis pregnancy in the sense that the pregnancy is not the crisis. The crisis is something going on in her life. Women need help. Pregnant women are just like any other women that's facing complicated situations in her life. And we have to address those underlying reasons why she might be seeking an abortion. And so, if pregnancy is not the crisis, let's fix the real crisis and not make babies or pregnancy into a crisis.
Let's talk briefly about what this looks like. What does wrap around healthcare look like? Why is this the most pro-life approach to medicine? And what does it look like practically?
So, practically speaking, if you're in a healthcare facility and you're receiving those medical services, it means that that medical office, just like Guiding Stars do, either co locates their services with other types of care providers or they directly refer out. So, co location or direct referral. So, co location means sharing space, it means bringing in that counselor, bringing in that infant loss support, bringing in that fertility teacher to share your space. Women are already comfortable going to your clinic for whatever their initial service was. Let's continue to offer them more services at the same location where they've already figured out where to go, how to access the service. They've already gotten to know you. It's easier for them. Let's take one load off with the questions of transportation and childcare. You have Child Watch at Guiding Star to take away that barrier to accessibility for services. So let us co-locate as best as we can, working together and finding these comprehensive one-stop shop women's centers. And then where that's not possible, let's know the local resources. And that's what Her Plan does for you.
We were talking before we hit record. You have a background in architecture. I have a background in interior design. What does pro-life medical, or how does being pro-life translate into
Mm.
space?
Oh, my favorite question. So I studied both sociology and architectural history at UVA, and I really embraced this term sociology of spaces. What does it feel like when you walk into a space? And it's so important for care providers of all times to put themselves in a woman's shoes and think about what she sees, what she encounters. Does she feel welcome? Does she feel like she knows where to go? Does she feel like it's a hospitable place? Is there something for the children to do like there is at a Guiding Star Center? Can we incorporate those principles of beauty and hope and joy even in the way we're presenting both the design and the layout of our buildings? And I think Guiding Star is really exploring that in really exciting ways. And it's a challenge for all the types of providers, medical, social, and material, to really think about that as they're presenting.